Good morning, Jen.
Good morning. How are you?
Good morning, Jen. It's Jen Hogan.
Hi, Jen. Martin. I'm going to test sharing my screen if everyone can just bear with me for a moment.
I can see it.
Do you see it?
Yes.
Yes.
Okay.
My computer's frozen. I can't seem to open the link that you sent, Jen.
Who is that?
This is Jen Hogan.
Huh.
I can't even with even my cursor over it. I'm getting nothing. So I don't know my computer. Maybe I should shut things down and see if I can reopen.
Yeah, I've noticed with Zoom meetings, it really depends on everyone's internet service. Sometimes if everybody shuts the videos down, then it frees it up, but.
Okay. Otherwise, we'll just have to listen.
And I'll send out the presentation and the meeting materials afterwards, so.
Okay. Okay. No worries.
I'm gonna go get my coffee.
We'll give people a few more minutes to log on. I don't know if anyone else has had issues with Zoom, but I know some of our coworkers use Zoom and had public links to the Zoom and then were Zoom bombed or whatever. So someone took over the meeting and started posting things that were not appropriate. So now we have to just give out the link privately. But it looks like Zoom is working on some of those issues. So.
Hey, Jen, is anybody from CDTA going to be on the call?
I don't know. I don't think anyone requested the link, so I'm not sure. But if anyone is, it would be Brent or Lindsay.
Okay. Yeah, because I saw, you have 1.2 and I had some bike share questions.
Okay.
They were going to be on.
Are people who are using the video, can you see my screen with the agenda up right now?
Yep.
Yep.
Yes.
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 Okay. So it's a little after 9. I want to get started. We may have people join. I know this is the first time we're having a meeting this way, but I wanted to make sure that we still continued to meet and discuss some of the programs and initiatives that CDTC has coming up related to walking and bicycling, so that we don't lose any kind of momentum or the ability to coordinate and collaborate on things. So thank you for being flexible and joining us this way. Typically we start with welcome and introductions, but what I'm going to do is ask that you should be able to see a chat if you mouse over at the bottom of your screen. I believe there should be a chat function, and if you could just write in there your name and who you are representing or where you're from. We'll take attendance this way, and yeah, we'll do it that way. Okay. So since this is the first time we're doing it this way, I'm hoping okay. Can everyone see the next slide?
Yes.
Okay, so I'm just asking if you have any background noise, if you can mute your microphone if possible. If you can't see the screen, you can just use the phone function. You don't have to use your camera if you don't want to, but I do like seeing everybody. If you have any questions or anything during the presentation, if you could use the chat function. And just so you know, our Zoom meetings are recorded and the chats are kind of preserved in a transcript. So even your private messages. So just a heads up, I know that these are things that we're all learning as we start to use Zoom more. So, okay, going to the next slide might be a little. Okay. So things that have come up during this public health crisis have been our ability to adapt and adapt quickly to a changing reality. So, and this isn't something that we haven't discussed before. We've just kind of discussed it in terms of other things. So we've been talking about resiliency in the transportation system and the ability to anticipate, prepare for, and adapt to changing conditions. But usually when we talk about it, we're talking about it, in relation to extreme weather, natural disasters, terrorism. But now we're seeing how this plays out in pandemics. So I just wanted to go over some things. I just kind of put this together pretty quickly about what's going on in the Capital District and in other cities and how transportation systems are adapting, particularly on the bike and ped side of things. So in resiliency planning, we've in the capital region talked a lot about extreme weather. We've had some incidences, like if you remember, I believe it was 2 winters ago, the boat that got loose on the Hudson because of a really rapid freeze and thaw. So we have had impacts to the transportation system because of weather and other issues. So in our planning documents, we recommend considering resiliency in transportation planning goals and objectives, identify, evaluate, and adopt strategies to address identified vulnerabilities. So looking at, which pieces of infrastructure are most vulnerable, screen projects during planning to avoid investing in vulnerable areas, include resilience and criteria for evaluating projects for funding, and consider future environmental conditions in corridor planning studies. So if we anticipate something like, flooding or sea level rise in a corridor, how do we build to and how do we make funding choices based on what we are anticipating? And of course, mobility choices and fuel and energy diversity. Usually in extreme weather situations or in Hurricane Sandy, we saw the fuel supply cut off. So it was important that fleet vehicles had other fuel options like natural gas or biodiesel, and were able to access that, or people could still walk and bike, because getting gas and being able to access your vehicle were not choices. Bear with me, I'm trying to. Okay. So in the case of the coronavirus and this current pandemic, we are being asked to address mobility needs while keeping people apart because of the nature of the virus. It's spreading through droplets generated when infected people cough and sneeze, and it can go on floors and surfaces, and then if people are within 3 feet of another person who has the virus and touch their face, it's highly contagious, and it's difficult to keep people apart so that we can contain this. And the ability to keep people apart so that we can maintain the capacity of our healthcare system is important. And despite all that, we still need to continue to get food and groceries, and our essential workers need to get to work. So we are trying to figure out how to do all that. New York State implemented the New York State on pause policy. So basically, most of us are teleworking or telecommuting. Kids are not at school, but they're being homeschooled or learning online. We're being asked to avoid grocery shopping. You can go grocery shopping, but only do it once a week or every other week. We can still go outside, but we're also being asked to avoid visiting elderly people or going to hospitals if we do not absolutely need to. Stores and malls are largely closed. The recommendations have been to avoid public transportation, group gatherings, playgrounds, play dates, all that kind of stuff. So basically stopping all optional trips and travel. And because of this, we're really seeing a lot of equity and health impacts in the system and in how this policy affects other people. So people are being asked to shelter in place, but not everyone has access to private and stable spaces. We're being asked to telework, and children are being asked to learn at home, and not everyone has access to a computer or internet. Access to groceries and medical care are not always possible without access to a private vehicle. And households that are reliant on public transportation for jobs and transit agencies, there are households that are reliant on transit to get to their jobs. But meanwhile, transit agencies are struggling to provide service and are having to reorganize to increase service to medical facilities. So there's some conflict there. many essential workers who we are increasingly reliant on right now don't have access to private vehicles. So, you know, we've talked a lot in the last 5 years about technology and integrating technology into the transportation system, and that's important, but this is an emergency and there really is no technological solution. We're getting back to kind of basics and how we move people. And there are neighborhoods and communities with complete streets that do have access to food and healthcare and jobs without relying on personal vehicles. These are more resilient, but we're seeing a lot of gaps throughout the region and throughout the country as we see cities and communities adapt to this new reality. So how are we adapting to social distancing? So we've had to respond rapidly to implement plans to reduce crowding, relieve crowded areas to support public health and social distancing on sidewalks and parks, create clear messaging of policies and guidelines to the public so that they're easy to understand, provide safe and efficient transportation to testing and medical facilities, and support unsheltered and vulnerable populations. So the first strategy, maintaining transportation systems to safely move essential workers and goods. So agencies and cities had to quickly establish protocols for frequent comprehensive cleaning of transit vehicles and facilities. So CDTA did this pretty immediately. Also establish backdoor boarding and waive fares to alleviate crowding and for operator safety. For those of you who don't know, last week CDTA implemented backdoor boarding only unless you have a mobility impairment and need to use the front door or need assistance, and they have waived all fares, and that's all of their transit services. Strategically adjust service to balance public need for essential trips with reduced staffing and operational capacity. So CDTA has also had to do this. They've increased service to the hospitals and testing sites while having to reduce service to other areas. Some cities are building kind of the pop-up bike lanes. In New York, they've classified bike shops as essential services. And some cities have offered free or reduced price bike share access. You know, this kind of started on our off season for bike share, so we don't really have the ability to do that just yet. And then also, you may have heard or seen some cities have converted actuated ped signals to fixed signals where possible, so getting rid of the button so people aren't touching them and then spreading germs more. So this is just the CDTA graphic that they put out last week about rear boarding only. These are some examples. On the left is Berlin, Germany, where they have actually expanded the bike lanes to provide more space. On the right, this isn't a response to COVID. This is actually just an example from the Saratoga Springs pop-up event, but just an example of how cities could quickly put up a bike lane. So the next strategy is keeping frontline workers safe and actively managing and supporting both operational and remote office workforces. So we've seen employers like the state in particular start staggering start times, enhance cleaning, and employ dispatch procedures for operations teams, provide guidance for managers to support remote teams, and then ensure adequate hardware, software, and program licensing for remote staff. So at CDTA, you know, we're all teleworking right now. I know a lot of the state agencies are and the municipal staffs. I think the interesting thing is that these are all TDM strategies that CDTC and other transportation planners have promoted as ideas for how we can kind of achieve some of our transportation system goals, like reducing congestion, reducing emissions and improving air quality, and reducing energy use in transportation. So the next strategy is addressing immediate delivery and pickup needs. So if you've been to a grocery store, you may have seen like the queuing outside on the sidewalk and the distance between people. Establishing dedicated delivery and loading zones for pickup. So I know in Albany, they have suspended kind of all of the parking regulations and have made the curb space just for picking up to-go food. Also, we've seen a lot of repurposing of vehicles and facilities. So transit buses, like the smaller shuttles, have been helping with delivering food and meals. And not in the capital region, but in other areas, we've seen parking garages kind of converted to overflow medical facilities. So some of these assets and infrastructure have had to be flexible and adapt and be used for other things. The next strategy is relieving crowded areas to support physical distancing. So this has been the most interesting thing to watch across the country and how cities are dealing with this. This is obviously not something that all communities really have to, it's not an issue in all communities, but in really dense, crowded cities, it has become an issue. So closing or limiting through traffic on select streets for social distancing, restricting access routes to areas and attractions where it is impractical to promote social distancing, make sidewalks one-way only, so to avoid people having to walk closely together, having one side of the street sidewalk one way and the other way. It's not super convenient all the time, but it does avoid some of those conflicts. And as traffic volumes drop, adjust signal timing to slow vehicle speeds and ensure safety. I know I've noticed in my neighborhood, as there's less traffic, people do seem to be driving faster. So there's also more people using the street for bicycling and recreation. So there are some conflicts there, and some cities have been trying to alleviate that. So some cities have very quickly implemented some open street programs. So these are just a list of, it's not totally, I'm sure I'm missing some cities, but these are just some cities that have implemented open streets. So they've closed down minor streets to traffic and kept them open so people can walk or bike or just get outside and be able to maintain that 6 feet of distance between others. Some cities have used a lane and put cones out and use it as an extended sidewalk. And then I just found it interesting that some of untraditional or transportation or people who are not traditionally involved in transportation, like Dan Rather, were advocating for widening sidewalks, even when this is all over, kind of just bringing attention to how our communities are currently designed, and how it's kind of highlighting some of the issues that we have. So this is a video, hopefully it will work, that I thought was amusing. You might like it. Doesn't look like it's working. Oh no. All right, I don't think that's gonna work. Anyway, there was a video, if you have a chance to go on YouTube, there's a video of a man in Toronto who made a social distancing machine. So he made a thing that goes in his head and is, 6 feet diameter, and he walks around his city to show how difficult it is to maintain that 6 feet of distance between him and other people while using the sidewalk. And basically he's walking in the middle of the street. So I just thought it was kind of a clever thing.
I thought that was what Martin had over his head in the background. He switched it though.
Oh,
There
that's just a UFO.
A UFO landing.
Yeah.
It feels that way right now. Jennifer, is it possible to get your presentation that you just showed us?
Yes, I'm gonna share it with everybody afterwards.
Thank you.
So the next strategy is creating clear messaging of policies and guidelines. So if you have been on the Northway or any of the highways, you've probably seen the electronic messaging signs that DOT maintains, where they've told people, basically stay home. There's some, clever, fun signage in some places. The state of New Jersey has been using kind of this maintain a full Danny DeVito between you and others, or this is Brighton outside of Rochester. They've used their supervisor, and they put signage along sidewalks and trails, encouraging people to maintain a safe space between them and others. If you've been out to one of the trails in the region, you've probably noticed, particularly some of the really popular trails like places on the Mohawk Hudson and the Albany County Rail Trail have been really crowded, which has been very frustrating to see. But also, you know, we understand that people are they need to get out and they want to exercise. So we've been trying to promote the keeping safe distances even while on the trail. But this is really important. Another strategy is providing transportation to testing and medical care. So we've seen a lot of publicly owned like property and buildings being converted to testing sites. So here in Albany, the University at Albany is a testing site. There are strict instructions to, you know, only come by car and to stay in your car. And this is obviously a problem for people who don't have a car. I have heard that when you talk to a medical provider before you get your appointment and you let them know that you don't have a car, they will try and get you transportation. But this, I think, is a major obstacle to people who don't have access to cars. And not all of these places are considering people who don't have access to cars. And then other things like getting unemployment benefits. Even there are states where they are, again, asking people to come and stay in their car and stay in a line to, you know, do paperwork, which, again, requiring people to have a car to get where they need to go in an emergency, buy a car and then stay in the car can be really problematic.
At least
Did you say something, Ivan?
yes, at least the emergency pickup for food and stuff should permit other than car pickup.
Yes. So then the last strategy of supporting unsheltered and vulnerable populations. We have seen some cities, New York City was repurposing taxi fleets to deliver groceries and medicine to vulnerable populations and elderly. Some limousine companies were also offering services. There have been some hotels that have offered rooms to unsheltered and vulnerable populations. And then, of course, again, providing transportation to testing sites. So if anyone is interested, I found some really interesting resources on responses to COVID-19 across the country. The National Association of City Transportation Officials, NACTO, has, if you go to their website, and I have all the links here, they have a big spreadsheet and it has multiple tabs on all the different strategies that different cities and regions across the country are using. They are categorized by city and region, by, you know, what kind of strategy it is. There's dates, there's links to the language of, you know, exactly what's going on. It's a really great resource if you're looking for anything. Bloomberg Philanthropies also has a toolkit for cities and communities. There's some GIS resources on the Esri site, and then the Google mobility reports, which I'm gonna show you an overview of that. But if you haven't seen them and you're interested in them, you can look up any county in the US to see changes in mobility. Whoops. If you're interested in data, big data resources, these are just some links. The graphic on the right is from the transit app, and it just shows kind of the change in transit demand in cities across the country. Albany is not included. The only upstate city that is included right now is Ithaca. Okay, so we have to go through this very quickly. So things that have changed that we've seen change is air quality. You may have noticed in your community, but in bigger cities, there's a much more noticeable difference in air quality because of lack of traffic. This is data that we just got at CDTC for the capital region showing the drop in traffic. So right now, vehicle miles traveled is 1/4 usual VMT, according to our data. This is some change in mobility. Again, I'm going to share these with everyone. So if we get cut off, I'll email these to everybody. So just showing, where people are going more and where people are going less. Obviously, less to retails and recreation and work.
Jen,
So-
how is recreation defined in the one? Why did you put retail and recreation together?
So these are right from Google,
Okay.
and they have a description of the data and stuff at their website, but I'd be happy to share all that with you, but I don't have it offhand, like right now. Some of the, other emerging issues that we're kind of tracking and thinking about is long-term health and sustainability of public transportation and shared mobility. Will people continue to avoid transit or purchase more cars? I think the conversation around density versus crowding is important because people are using density as, something that's bad. And really it's the crowding aspect. So how will this impact future land use and development decisions? Will we plan for and use public spaces differently in the future? Of course, our long-term economic health, and will automation and telework accelerate, and how will that change our transportation and our communities? So I just wanted to give that really quick overview of some of the things that I've been tracking and collecting through all of this. And I will share all that with you. But then other CDTC initiatives that are moving forward that I wanted to provide an update on. The Complete Streets Workshop, if you go to the CDTC website, you will find information about the Complete Streets Workshops and our solicitation. So they're free, interactive workshops for communities. There are 4 types of workshops that we can tailor to your community based on your needs. So like the basics, or maybe you need to develop a policy, or you need to implement a policy, or you just need a county-wide training. We will work with you and do that. So the applications are due June 19th, and all of the information and the application forms can be found on the CDTC website. Rima, do you want to quickly talk about the Pledge to Ride?
Sure. Can you hear me?
Yep.
Okay. So, we normally do a bike to work challenge that's organized around workplaces, and they create teams and then they compete against each other in each county to see who can get the highest participation rate and the largest team in the county. But since we don't really have workplaces structured the way that they normally had been, and everything is so disrupted, we opted to do a Pledge to Ride campaign this spring instead, from May 1st to June 5th. And it's simply just you take a pledge to ride at least once between May 1st and June 5th. And you could, of course, ride more than that, but the minimum is like one time. And it's open to all ages. There's no reason why kids can't ride their bikes for recreation. And, at this time too, as long as everyone's practicing safe social distancing. So yeah, that's it in a nutshell. We're offering a social media raffle. So if you sign the pledge and you use the hashtag 518 Pledge to Ride, when you're posting a picture of your ride on Facebook, Twitter, or Instagram, you will be entered to win a raffle prize. And provided everything, starts moving towards normal, this fall, we'll plan to organize a Bike to Work challenge in the fall, and also a Bike to School challenge.
Yeah, National Bike to School Day has been moved to be combined with Walk to School Day in October. So
Rima, can I ask you a question?
Yeah, of course.
So Black Girls Do Bike, we canceled all of our upcoming group rides for now, anyway. But
Okay.
our outdoor group rides, I should say, we've been doing a lot of virtual rides. If we're not back to normal, if we'll ever be back to normal by May 1st, would the virtual rides count?
What do you mean by virtual ride? What is that?
So we've connected with Zwift and Peloton. So you're able to do virtual rides. So I have a trainer, which basically converts my my regular road bike to an indoor bike, and I'm able to ride using Peloton with
Oh,
my
okay.
fellow riders. Yeah.
Oh, so like everybody sort of
Right.
together.
Whoever, yeah, whether they have whether they're converting their road bikes to stationary bikes, or if they have a stationary bike. And some people
Mhm,
are fortunate enough to actually have a Peloton. But
mhm.
yeah,
Yeah.
so that's what we've been doing.
Okay. Yeah. I mean, the pledge to ride, it's not a competition like the Bike to Work challenge was. So it's. I mean, I think we were conceiving it as like an actual bike, a road bike or a mountain bike outside, on the road. But I mean, it's there aren't any really hard and fast rules. Like, I'm not saying you can't pledge because you're doing a virtual ride. So
Right.
I mean that sounds like a great idea. People are getting up, they're getting together, they're moving around. I don't have any problem with it.
Much less the virtual ride is basically if you have a chore to do and you would take your car, like going to the post office for me, it's easy to take a bike,
Mhm.
and it's a legitimate needed ride with something for a walk, longer
Mhm.
walk. So I would report that, I would expect to you.
Yeah. Yeah. Well, we're not having people report. It's just you sort of promise that you'll ride your bike.
Okay.
yeah.
I
Why
took
don't,
a promise, and I will put it in words.
so we have 2 minutes left on our meeting that Zoom is gonna like cut us off. So I just want to kind of circle around on this. Allison and Rima, maybe I can connect you both and we can talk about how we can, if we can do the virtual stuff. I think that's a fun idea. Also, if you haven't already gone into the group chat and just typed your name and who you're representing, I would really appreciate that so we can make sure we have attendance from everyone that's on the call right now. If you can, I'm going to send out this presentation and all the other materials, so you'll get the status report on linkage and all upcoming events and projects. CDTC has canceled all presentations and in-person meetings through the end of this month in accordance with the New York State on Pause policy. We are continuing to do New Visions outreach, so we encourage you to go to the website and take our survey, and we'll be doing some webinars, Facebook Live, that kind of stuff in the near future. So I hope everyone stays safe and healthy, and I will be in touch with an email following up on this, and hopefully we can meet again next month. All right, so it's good seeing everybody.
Thank you,
Okay.
Jen.
Thanks, Jen. Be well.
Thank you. It was a fine presentation.
Thanks,
Jen,
everyone.
oh, I guess she's gone.
Wait, what? Oh, Jen?
Yeah, the one thing you didn't mention was the electric bikes after the state budget became legal.
Oh yeah, it was included in the budget.
Yeah.
So we should have, I'll find legislation and I can attach that to the meeting notes.
That would be great because I
Okay.
want to share it with our council.
Okay.